In the 1950s, when nuclear reactors were first built, the Cold War mentality, which of course began with nuclear weapons, was passed along to civilian use of nuclear power. And as far as health was concerned, the regulators, which at the time was the Atomic Energy Commission, later the NRC, did a couple of things. In their regulations, they made no provision, there was no mandate to do any sort of studies of health near nuclear plants. And the other thing they did was they set what was called permissible limits, that they would require testing of levels of radioactivity and radioactive releases around the plant. If it fell below a certain level, the permissible limit, that was not just evidence that the plant can continue to operate, but to them, it was a check that health was not being affected at all. We get to the 1980s, and that's when two of my colleagues, Jay Gould, a statistician, and Ernest Sternglass, a physicist, decided to create our PHP because of this great dearth of study on the health issue. There was an article in 1987 by Richard Clapp from Boston University. He found that near the Pilgrim plant in Massachusetts, there was an elevated level of leukemia. And because this is in Massachusetts, that article got to the desk of Senator Edward Kennedy. And that prompted Kennedy to write a letter to the NIH director. Kennedy said it would be appropriate if the NIH could address the issue of a causal connection. And within 3 weeks, the NIH wrote back saying, we are conducting county-based cancer mortality studies from the 1950s to the early 1980s. And everybody, and I'm sure Senator Kennedy as well, was surprised. And, oh, we didn't know. But obviously with Kennedy's position, they moved on. This is the first, and to this day, the only published study by the federal government on cancer near nuclear plants. It was published in 1990. The conclusion was there is no connection between the opening of nuclear plants and increased local cancer rates. I've gone through that study many, many times. There are a number of places, including San Onofre, which showed an increase once the plant began operating. So it was at this point we decided to start the group. Basically, what we found is that in most cases, county or counties closest to a plant, when it opens, the cancer rate compared to the U.S. goes up. I mean, the gap between the local and the national rate grows and grows. Number two, we've done studies showing the opposite. When you close a nuclear plant, that immediately there are sharp declines in local infant mortality and local cancer rates in children under the age of 5, and longer term drops in cancer among all ages. And finally, the thing that we're probably most noted for is the baby tooth study. We've looked at over 5,000 teeth in children living near to and far from nuclear plants. We found higher levels in the ones that live close. We've found that they're rising over time. We found that there's a connection with childhood cancer. When one goes up, the other goes up, and one goes down, the other goes down. So we are taking this study to a second level where we're going to compare the strontium-90 in teeth of children living in nuclear plants. The first one will be the Fermi plant near Detroit. We're going to compare them with teeth from people who gave teeth in the 1960 study, people who were exposed to bomb fallout early in life. We're going to ask the question, what was greater? The people born in the 50s and the 60s who got bomb testing fallout early in life, or today's children who are getting reactor emissions early in life? No one's addressed that. We're going to find out.